So infectious diseases, before about the mid-20th century, were one of the leading causes of death in the United States. And there's been a lot of public health pushes, including vaccinations and antibiotics, that have created a pretty significant decrease in your infections, mortality, and morbidity. Now, to be fair, there have been some recent reemergence with people who are not able or refusing to take vaccines, but as a whole, infectious illness death is down across the board. Now, these infectious diseases or illnesses are caused by living organisms that come inside the body and try to take over. And this could be a bacteria, a virus, fungus, could be a parasite. There's a whole lot of stuff out there that resides in and on the body. And, out of the millions of bacteria in and around your body at any given time, only a handful of them are pathogenic or produce some sort of disease. Most pathogens are going to, they're going to result in some relatively mild illness, because generally the pathogen doesn't want to kill you because then it doesn't have a host so that it dies. But where you give them to the big problems is when what should be a relatively mild illness, and most people, can become a life threat to people who are immunocompromised or something like that. Now, for our healthcare providers, you won't be concerned about infections that are more prevalent among patients who've been exposed to the healthcare system. We don't want to reinfect these patients or infect them at all. A lot of these hospital or ambulance-acquired infections are antibiotic resistant and hard to treat, and so if they have some underlying issues as well, could be a problem there. Now, we know that we have a lot of different ways to protect against your infectious illnesses, and one of the biggest ones are the skin and mucous membranes. Right? They literally provide a barrier between the inside and outside of the body. Our bodily fluids have these antimicrobial substances like the blood. The white blood cells recognize foreign material even if they've never seen it before, and will start to vigorously defend the body. And we recognize this as inflammation and fever, so it doesn't feel all that great. We feel like, oh man, I got the crud, but your body's actually doing what it's supposed to do and try to fend off this disease or this pathogen. The body will even use some microorganisms that are normally in the body to prevent disease, and these are different strains of bacteria that are normally found in the mouth, the nose, the skin, or the GI tract. These are normal flora. And so this normal flora is going to kind of limit the growth of pathogens. Now, the problem is some antibiotics, when you take it for one bacteria, it doesn't always differentiate, so it can kill normal flora in the course of fighting an infection. This lets the bad bacteria that are not susceptible to antibiotic overgrow, or fungus like candida, which leads to yeast infections. These are called opportunistic infections. Now, immunity is a response to specific pathogens, and we have two major types of immunity. We've got passive immunity and active immunity. So passive immunity is going to happen without activation of the immune system. Makes sense, right? So you have natural passive immunity, and this is going to last the first couple of months of life, and this is from the maternal antibodies that are passed on to the fetus through the placenta and continue on through breastfeeding. You have acquired passive immunity, and this is injections of an immunoglobulin or antibody for a specific disease. So this is like your tetanus shot, where you only get it as needed, but it's for one specific disease there. Now, when we stimulate the immune system, this is going to produce a kind of memory that develops your active memory. So natural active immunity occurs when the body is first exposed to a pathogen, and it stimulates the body to produce memory B cells or memory T cells. And this first exposure to it may or may not produce signs and symptoms. That's why if you ever have heard people talking about letting kids run around and be kids, and it's not good to let them be super clean all the time, because if you're not exposed to different bacteria and viruses and things along the way of growing up, then you don't have a developed immune system, which can cause much more problems later on in life. Now, natural induced active immunity is going to be where the body receives some sort of vaccination, and then these vaccines are going to contain either a live weakened pathogen or a killed pathogen. When put into the body, these cannot produce a disease. They will not produce a disease. But the body develops a memory for them. And in most cases, this immunity is lifelong, but not always. So it's a good idea to get titer levels drawn for your immunizations. Now, you will hear people, oh, I got the flu shot and I got the flu. No, it doesn't happen that way. One of two things has either happened. Number one, you already had been exposed to the flu before you got the flu shot and therefore developed the flu. Or number two, sometimes these vaccines can cause, they're causing your immune system to activate. So when we recognize, what we recognize as signs of the flu or the cold or things like that, the inflammation, the achy feelings, the fever, the tired, fatigue, that kind of stuff, that's just our immune system fighting off the bacteria. So what they may perceive as the flu, and I'm using quotation marks around the flu, is actually just their immune system making them immune to the flu. It's activated, it's developing a memory, so that way if they actually encounter the flu, they can fight it off. Now, the pathogens can be introduced into the body a whole lot of different ways. Some of the main ones, of course, injured skin, mucosal membranes, respiratory, digestive, urinary, reproductive tracts. But it's important to note that not every contact with the disease constitutes an exposure, and not every exposure leads to infection. Right? So, for example, if you have contact between infectious blood and intact skin, let's say somebody has AIDS and they drip a drop of blood on your arm that has no cuts in it, it's intact. That's not an exposure. All right? But let's say that this same blood accidentally got in your eye because that's a mucous membrane. That would be an exposure. Now, whether or not you're going to develop disease depends on a whole lot of things, and one of those things is how virulent or strong the pathogen is, and how your body's own ability to resist the disease. You know, if you're already sick, then infection's a little bit easier to take place. We want to create an environment that's not hospitable to pathogens. So we want to wash hands. We want to use standard precautions. We want to try to put in place physical barriers whenever we can. Now, when the body is exposed to a bunch of different pathogens, some infections can be transmitted from one person to another, either directly or indirectly. That would be a communicable disease. Direct transmission is going to be, like, say, somebody's close contact or close proximity and they sneeze on somebody, or they kiss somebody, or have sexual contact with somebody. Indirect transmission is when the infected person contaminates a fomite, which is just some inanimate or some other surface or object, and then that person comes in contact with it. So this would be, say, somebody sneezes in their hand and then touches a doorknob, and then another person comes along behind them and touches the same doorknob. And then you've got vector-borne, and this is where, like, insects or animals or something like that. So these infectious illnesses are classified primarily by their routes of entry and exit into the body. And so this is like your direct contact, your airborne, your sexually transmitted diseases, bloodborne, GI, respiratory, etc. Now, once a pathogen gets access to the body, it has to multiply or colonize in the body in order to cause an infection. It has to have enough, essentially, viral load or load of that bacteria to create an infection. And from there, the infection can take a couple of different routes. Some infections are asymptomatic, and these are also sometimes called subclinical if they're asymptomatic. In these unapparent infections, a person's infected, but they never have signs and symptoms of an illness, but they may test positive on a disease-specific antibody, saying that they were infected in the past. Now, your incubation period. This is the time between the time of exposure and the onset of signs and symptoms. And this varies based on different illnesses. Some have a very short incubation period, some have a longer incubation period, some have incubation periods of months or even years. The latent period is the time between exposure and the onset of signs or symptoms, or between periods of active disease. The window phase is going to be the period between exposure and production of enough antibodies to be detected. So, in other words, let's say if you had a contact with AIDS or HIV and you were going to develop HIV, if you were tested that day, right then and there, you would test negative because there's not enough viral load in your body, enough virus present in your body to be able to be detected by the test. It doesn't mean you don't have it, it's just not enough there to notice yet, essentially. The disease period is where you are actually having the signs and symptoms, and the disease period ends when the signs and symptoms resolve or the patient dies. In some cases, some patients can actually become a carrier of a disease, and what this means is they remain capable of transmitting the disease, but the signs and symptoms have resolved or were never present at all. Now, with their pathogens, your primary pathogens are going to be bacteria, viruses, fungus, and parasites. Bacteria are single-celled organisms that can reproduce. And this would be like your streptococcal diseases, staph diseases, gonorrhea, E. coli, things like that. Now, your bacteria are going to cause damage to your tissues directly, or they're going to produce toxins that cause problems with their surrounding tissues. Antibiotics are effective against a lot of bacteria, but there are some antibiotic-resistant strains of bacteria due to overuse of antibiotics. There's several different resistant forms of tuberculosis. There's a whole lot of stuff there. Some people do have allergic reactions, and it does kill some of the normal flora. So there are side effects to antibiotics. So really only need them when you absolutely need them, not just for the common cold. Common cold is flu, is a virus. Now, with your viruses, they can contain DNA or RNA, but not both. So what this means is they have to gain access to a host cell, and then they're going to use the host genetic material to fill in the blanks for what they don't have. And so essentially they turn this infected cell into a virus factory, chugging out or turning out more viruses using their DNA or RNA. And these are going to be like some of your rhinoviruses. These are the ones that cause the common cold, the flu, herpes, HIV, hepatitis. And a lot of times when you get a viral infection, it results in immunologic memory, and meaning you're not going to ever get that one again. But there are some viruses like hepatitis B and hepatitis C that can become chronic, and others like the herpes that can go dormant and then just reemerge sometimes, especially like in times of stress. Now, there are drugs available that can inhibit your viral reproduction, but antibiotics do not work against viruses. Now, your fungus are simple plants like yeast, and they can live and reproduce in the body. They exist in the normal flora, but when the immune system is compromised, they can actually overgrow and reproduce at a greater rate, causing the opportunistic infection. Probably one of the more common ones would include your candida strains that cause like your thrush, your skin infections, vaginal yeast infections, ringworm, things like that. Now, protozoa, single-celled animals with the ability to move. They look like stuff out of your nightmares if you ever look at an up-close picture of it. Some of them can be found in contaminated water and can cause severe GI illness. Don't drink the water if like you're swimming in a lake or something. Don't drink the water. Try not to get it in your cavities. Right? Malaria is another parasite that's transmitted by mosquitoes, and these parasites can be either internal or external. So it could be like worms, it could be hookworms, it could be trichinella, a lot of tapeworms, a lot of different things. Even scabies and lice fall under a lot of these parasites there. So infection control, what can we do? Be responsible for your own safety. Right? Protect yourself against these infectious diseases. Maintain general health. Get your immunizations and have them checked on a regular basis to make sure you, in fact, still are immune to things. Wash your hands. People don't wash their hands often enough, and they don't wash them very well. Wash your hands. 1 gram of poop contains like 1 million plus bacteria. Wash your hands. People are nasty. All right. If you are exposed to an infectious illness, follow the policy of your employers for evaluation and reporting. All right. We should not come to work if we have some sort of infectious disease, because not only are we at greater risk for catching something, but we could potentially make an immunocompromised patient much, much sicker, or even potentially give them we will make sure that we clean our ambulances, our patient care environment, our reusable equipment, so that way we're not accidentally putting our patients in contact with these things, and make sure that we dispose of used equipment properly.